2. The woman in the cellar. This case happened a few years ago in a summer afternoon. A middle-aged man with a sweaty head ran into the outpatient department and asked for emergency treatment. He walked fast, spoke confidently, and showed no signs of illness except that he was out of breath from running, so I asked him to make an appointment and wait in line. The man said, "It's not me, it's my mother. She's in the ambulance." The paramedics sent me to get a doctor to handle the situation. I was confused. Ambulance patients are usually wheeled straight into the emergency room without stopping. Doctors have never been called to the entrance to see patients. What the hell is going on? The man was very frightened and nervous. Hence, I did not dare to delay and followed him out. The ambulance emergency light was on, but the siren was quiet. An old lady was strapped to a stretcher struggling. I was curious and asked the two paramedics, "What's going on?" They explained. Patient is a 67-year-old female. This morning, she fell into her backyard cellar while reaching for potatoes. Her husband waited, but she didn't return for a long time, so he went to look for her. Seeing her unconscious in the cellar, he immediately called neighbors to get her out and called an ambulance. When the ambulance arrived 15 minutes later, the paramedics found the patient sitting in the room, perfectly fine, chatting with several neighbors. They examined her and found no signs of trauma. The patient spoke logically and felt no pain. The paramedics decided to leave, but the neighbors and her husband stopped them. They asked the paramedics to take the old lady to the hospital for examination. The paramedics didn't think it was necessary. However, the patient's family and neighbors told the paramedics she returned to the room and was full of vitality. Her lameness, caused by the pain in the back and knees for many years, is also gone. What's even stranger was her speech. This woman was married from another place a few years ago, and she spoke a dialect of a distant mountainous area. Although everyone here could understand it, the difference was huge after all. However, since she came out of the cellar, she could speak the local dialect even more authentic than locals, using very old-fashioned words. And that's not all. She knew those neighbors' embarrassing childhood stories, including the names and identities of their grandparents. These neighbors are in their 60s and 70s. Their grandparents had long passed away, and they couldn't even tell each other the names of their grandparents. The street names given by the patient were all from pre-World War II town layouts. These names were no longer used after World War II. Everyone was shocked and insisted that the patient goes to the hospital for further examination. However, the patient refused to get on the ambulance no matter what. With several people's help, she was tied up on the stretcher and sent here. When they arrived at the hospital, the paramedics hesitated. Where should we send her? To ER? The old lady has no injury. So they decided to call a doctor out for advice. The patient is conscious with normal pupil reflexes to light, and has no other symptoms. She spoke with strong voice, her limbs were strong when struggling, and there was sharpness in her eyes. At that moment, her husband also arrived. The husband said that his wife's pupils used to be brown, but now they are blue, and she also talked strangely. She is not his wife, but she could call out his childhood nickname. That cellar had an accident during World War II. I didn't know the details because my family took me out of town for refuge. I heard that some people hid in the cellar, and several didn't make it out. It has been a taboo to mention it, so very few people know about it now. I didn't think it was necessary to keep her constrained, so I ordered a CT scan to rule out certain possibilities. 2 hours later, all the test results came out. The patient's pre-existing diseases were all gone, and she was healthier than me. What's even stranger is that the ultrasound clearly shows the gallbladder that the patient removed 3 years ago due to gallstones. I was informed by a colleague about this, but this was not written into the clinical report in case it causes any medical disputes. I brought the patient to a separate room so I could chat with her. I was very curious. Since I knew almost nothing about the past local culture and social backgrounds, I was not interested in the old stories that she talked about. Besides, most of the words she used were very foreign to me. She is obviously a country housewife, and I was afraid that she had never cared about any major events in her life. After a long time chatting with her, I acquired no valuable information at all. I could only confirm that she was born in 1892, grew up in this small town, married a local shoemaker, and had 3 children. As the war approached, the cannons rumbled. She and several women hid in the cellar for fear of accidental injuries and Soviet soldiers, and did not dare to come out. Until just now, it was as if she was carried out from the cellar. After waking up, she found a room full of people, and when she asked for their names, she found that these children had suddenly become older than her. She was tied to an ambulance and sent here when she was still wandering. She was fed up and only wanted to go home to get a good sleep. She's so tired. Maybe she had been exposed to methane gas and had fallen asleep while hiding in that cellar. Boy, I'm out of options. What should I do? A nurse knocked on the door. A group of people gathered at the corridor, saying they were the patient's grandchildren. It turned out that after she said her name, the neighbors asked around and found her family. These grandchildren still live in this town, all in their 60s. They and their neighbors were born after the war and did not know each other. They brought the old family photo albums. The patient looked at the pictures of her children and cried sadly. She pointed at the old photos one by one and told stories. I got out of the room to do something else. At 5 o'clock in the afternoon, I went back to see the patient before leaving work. The patient and her family had already left. I asked the nurse, what happened later? The nurse said, the patient cried for a long time holding the photo album. She saw photos of her family attending her funeral before she was buried. Looking at her portrait, she was stunned for a long time. After giving instructions to her grandchildren one by one, she went to bed and even snored. The whole room was at a loss. 10 minutes later, the husband realized that the snoring sound was familiar. He walked over and shook the old lady awake. The old lady, who knew nothing about the fall, was surprised to find herself in the hospital and a room full of people. Since all tests proved the patient healthy, there was no reason to keep her overnight for observation. Everyone left, and that was about 10 minutes ago. I secretly regret missing the best part.